more insights from the Seattle study tour. The group from this morning have discussed and debated what were the key lessons from Harborview Medical Center, and a few of these included things like getting patient feedback on communication standards and skills throughout the workforce, including doctors. They liked the coaching approach that they took in the hospital in terms of developing frontline staff, so things aren't stored up for a sentinel incident. If something's not going well, that's discussed, it's debated, people know where they stand. And they do quality improvement development in a less formal way than other organizations we will visit this week. But they do invest in teaching the basics of Kaizen, and they do take part in waste tours. I think one of the things that was really striking was the constituency, the main patient population for Harborview Medical Center is the deprived population, the vulnerable, the people that no one else will look after. And many of the leaders on the tour commented on how this approach to caring for the most vulnerable gets Harborview Medical Center people attracted to work there with a different set of values. And they were reflecting on, is there more that we can do in the NHS and in the care sector in the UK to get people using that set of values? There's something about the integration that's coming from the Accountable Care Network that seems to be inevitable in the UK, whether that's through Devo Manc, Devo London, Devo any other city, and thinking much wider about probably the main insight, the key insight for me from listening to the group today was, as clinicians, as frontline leaders at every level in health and care, this ability to see beyond the role that you hold, the ability to think more broadly than being a doctor, to think about the community, to think about outreach, to think about integrating health and care. And so I think that's probably the biggest message that leaders are taking back from Harborview, is the need to put other parts of the health and care system, and really to think of your social responsibility, to think about the social services that must integrate with health, primary care, secondary care, mental health, outreach, rehabilitation, and to be able to do the best for patient populations. So as the sun sets on our day here at the Space Needle, that's some of the messages that leaders are taking back.